Hello, I am Juno Jung from the Medical History in Modern Korea. In order to understand the relationship between society and medicine on the Korean peninsula as a whole, it is necessary to look at North Korea as well. South and North Korea, which existed as one before 1945, diverged to different political systems after the division of the country. Let's take a look at how medicine took on different forms in each system. If we compare the formulation of medicine in North Korea with that of South Korea, the characteristics of Korean medicine will become clearer.
Red intelligentsia.
Including North Korea, socialist countries have typical welfare policies, such as free education and free medical treatment, which characterize their social systems. North Korea's healthcare system, which was distinct from that of South Korea, began to be created in August 1945 after liberation. In January 1953, North Korea declared the implementation of free medical treatment. And then in 1960, it announced the implementation of complete and total free medical treatment for all citizens. This was a different policy from that of South Korea, which pursued a quantitative expansion of healthcare services centered on the private market. Of course, as in South Korea, there were limitations in resources and personnel, which led to various compromises. However, it was clear that these policies were distinct from those of South Korea. And the relationship between the state's medical profession and patients also took on a different form. Let's begin with looking at how the medical profession in North Korea formed a relationship with the society and the state. Intelligentsia, the educated class of scholars and academics, including doctors, had always been a topic of great importance to the North Korean Workers' Party. The Workers' Party takes pride on having solved this problem in a creative and exemplary way that is unprecedented in the world. North Korea observed the fall of socialist countries, including the Eastern Bloc and the Soviet Union, as a result of their inability to properly address the duality of intelligentsia. After liberation, North Korea had an absolute shortage of the number of intelligentsia required to build socialism. So, it kept the old intelligentsia from the Japanese era active, even if their background and ideology were somewhat problematic. Kim Il-sung, who had consolidated his power by purging domestic factions during the Korean War, faced serious challenges from within the party. In 1956, in the wake of the August sectarian incident, the event that ended the internal power struggle and put Kim Il-sung in the center, the mainstream faction, led by Kim Il-sung, launched an anti-sectarian struggle that resulted in intense censorship and ideological struggle against the intelligentsia. The previous trend of placing emphasis on the technical expertise of the intelligentsia was radically changed by the anti-sectarian struggle. Ideology became paramount in the entire society. And those who did not prioritize party policy were criticized and even ousted. The nationwide ideological struggle, which was sparked by the anti-sectarian struggle, was mobilized by the Cholima movement of health workers. And the ideological struggle in healthcare, as an anti-sectarian struggle, was started by Kim Il-sung and the party Central Committee, which attending the National Health Workers Conference in April 1959. After urging health workers across the country to struggle against the remnants of old bourgeois ideas, an all-out ideological struggle took place in institutions of health sectors and sectors across the country. In addition to the struggle against individualism, egoism, liberalism, passivity, conservatism, formalism, and bureaucracy, the healthcare sector was required to follow the policies of the party of prioritizing preventive medicine, the absolute embrace of socialist medical theory, and the rejection of technocracy. As a result, in the second half of 1959, a number of long-standing intelligentsia doctors were harshly criticized and purged as reactionaries. These were mainly doctors who have been trained during the Japanese occupation, and after liberation, they had been teaching and researching at North Korean medical schools. This was a change in attitude from a policy of tolerance towards former intelligentsia due to a shortage of healthcare professionals. Since 1956, the ideological struggle, which began as an anti-sectarian struggle, had transformed the North Korean healthcare workforce into a socialist healthcare system from its fundamental.
Ideological struggle in medicine.
Cultivating intelligentsia in the healthcare sector had been a major challenge. Throughout World War II and the Korean War, epidemic prevention and sanitation became an urgent problem. There was also an urgent need to train healthcare personnel to carry out socialist health works. The implementation of universal free healthcare required a workforce to deliver it. But fewer than 1,000 doctors remained in North Korea after liberation. And even fewer faculty members were available to train the workforce at universities. In addition, socialist reforms, including a series of land reforms, nationalization, and conversion of private hospitals into public, caused many doctors to become agitated and defective to South. By 1948, North Korea had expanded medical education, establishing 3 medical universities and 6 specialist schools to train healthcare workers. In addition, to create a new socialist health workforce using existing intelligentsia, the healthcare sector was also subjected to indoctrination and censorship. Medical faculty at universities such as Pyongyang and Hamhung Medical University to train healthcare workers were also subjected to censorship. After the Korean War, the shortage of healthcare workers became even more serious. Even during the war, Kim Il-sung tried to recruit professors from universities located in Seoul. A number of professors from South Korean medical schools defected to the North during the war. Meanwhile, in 1958, a number of international students who were sent to the Soviet Union returned home to help with education. This meant that there was less need for colonial or South Korean background educators. A new generation of doctors emerged, educated and trained in North Korea over the course of a decade. North Korea regarded them as capable of producing intelligentsia that would again fit into North Korean society. This set the scene for a long purge of intelligentsia that began in the healthcare sector in 1959. But at its core, it also emerged out of North Korea's internal political struggles, the most significant of which was the 1956 August sectarian incident. In February 1956, at the Second Congress of the Communist Party of the Soviet Union, criticism of Stalin's personal cult was leveled at him. At the time, North Korean politics was centered around Kim Il-sung, but several factions were vying for power, including socialists from South Korea and Soviet Union. They claimed that Kim Il-sung was idolized, like Stalin, and they openly criticized Kim at the party Central Committee, and sought to remove him from power. This domestic and international situation led to criticism of party policies among professors and students at North Korean universities, and other institutions of higher education as well as among students abroad. Ultimately, this attempt failed, and instead resulted in a massive purge of the other factions, concentrating power in Kim Il-sung's hand. In the immediate aftermath of this power struggle, ideological censorship and purges began first at the Ministry of Education, which was the highest educational administrative body of the nation, and then at universities, in order to cleanse the intelligentsia of those agitated by the domestic and international situations. Between 1957 and 1958, anti-sectarian and ideological struggle were waged against Pyongyang and Hamhung medical universities and their respective hospitals, which were subjected to months of intensive guidance from Party Central Committee. Pyongyang and Hamhung medical universities were the most important institution in North Korea's intelligentsia policy, since they were the top medical schools in the country, and produced scholars and teachers to train intelligentsia in the healthcare sector. In May 1958, the Ministry of Health criticized doctors and pharmacists who had been subject of transformation into new intelligentsia to serve the people, but whose ideas were markedly behind.
New Red Health Workers.
The ideological struggle in the health sector, which had been intensifying since late 1958, became all-out movement when the party leadership, including Kim Il-sung, called for an ideological struggle at the National Health Workers Conference in Pyongyang between April 21st and 24th in 1959. The conference was attended by 1,500 health workers from all over the country. It was at this conference that criticism from below emerged as a tool to address the long-standing ideological problem of the intelligentsia that had been pointed out earlier. There is a clear hierarchy in hospitals. There is a chain of command from doctor to nurse, from nurse to carer, then to the patient. And this creates a sort of hierarchy. Within this hierarchy, it's not easy for criticism to come from the bottom. But the work of doctors, who had been hiding behind the mysticism of technology and avoiding criticism, began to be questioned. And the assembled medical staff began to point out that this hierarchy was actually hindering the party's health work. For example, a journal from the Ministry of Health reported that nurses were actively engaged in criticizing doctors, and that doctors, including the director, were being forced to correct bureaucratic and individualistic deficiencies. The struggle against technocracy, which became a major part of the ideological struggle in healthcare in 1959, was aimed at long-standing academic intelligentsia whose medical skills and expertise were highly valued. The technocrats were portrayed as those who had taken research and new treatments and applied them to diagnostic and therapeutic projects at will, causing patients to suffer, rather than addressing practical issues that could alleviate people's suffering. They were accused of making a show of their personal brilliance and authority. As a result, they were injecting a therapeutic almighty ideas into society, rather than prevention that the party wanted to promote. In the midst of the formation of a Kim Il-sung-centered system of power, the non-partisan old intelligentsia became a new major obstacle to the construction of socialism. The biggest problem with the old intelligentsia was that their enormous influences prevented party policy from being properly implemented, and they had a decisively negative impact on the training of a new generation of intelligentsia. A culture dominated by the authority of masters with experience and expertise was seen as a major impediment to the development of a new generation of red workers who would obey party's orders and mobilization no matter what. The process of neutralizing the authority and influence of the old intelligentsia over the new intelligentsia and absolutizing party policy was also the culmination of an ideological struggle against the old intelligentsia.